Hey, it's Jessica DaMassa with WTF Health, and joining me right now is Javier. He is the CEO of IOMED, and IOMED is a platform that layers on top of an EMR and helps provide different data analytics based on the data that it's aggregating, including the natural language processing data that it does in Spanish language. So welcome. It's good to talk to you, Javier.
Thank you very much for having me again.
Thank you. It's a pleasure to have you again. So last time we talked, we caught up with you as a startup. So anybody wanting to see that interview can find that interview. So what I want to talk to you this time around about is some of this meaningful use, like case studies with AI companies. I feel like the market has a lot of different AI companies. A lot of companies are using natural language processing. They're doing exactly what you're doing. Mm-hmm. So tell me some of the things that you have found out that kind of make you a little bit different. What are some of the things that you're using in terms of looking at the data and finding, I guess, meaningful outcomes from those analytics and being able to change the way that patients behave?
We believe very much in generating results. So there is a lot going on in terms of data analytics, a lot of going on in terms of natural language processing. There's a lot of that that's not actually bringing a real result that impacts patients or organizations or providers. So we believe very much in generating that impact. And I think a very good case study example for that is something we are actually developing in Spain, which is generating or actually enhancing access to palliative care through data analytics. For example, in Spain, we have a huge problem with palliative care. Few patients actually accessing real quality palliative care in our country because of lack of infrastructure. But the thing is, through data analytics, we can predict which patients in a patient population will need palliative care in a defined period of time, for example, 3 to 12 months, enabling then providers to actually take action beforehand and helping these patients to actually access palliative care through this predicting. So that's a real impact that impacts, of course, the patient because they get access to this quality service, but also it impacts providers because they then can save money through a better and more efficient service provision. And it actually impacts the society as a whole, given that we actually free resources in that provider organization.
I'd like to pick your brain a little bit about, I guess, working in the EMR system or like working with an EMR in Spain, mm-hmm. and what it's like in Europe and what the system is like there, because it's very different than the healthcare system here in the US, or it's very different than the healthcare system in Asia or in South America or Latin America. And I know you're looking to expand in those places. So I want to get a sense from you. I mean, talk to me about the EMR system in Europe. Is it good? Is it bad? Is it ahead of the US? Like, give us a little bit of a perspective on that.
One of the biggest changes between the US and Europe is that US is one country, Europe is a bunch of countries different. So you will have a different market penetration of EMR systems depending on the country. Whereas in the US, you have a pretty homogeneous market penetration of these systems. So when it comes to Europe, it's difficult to say, let's say, a single picture of the whole continent. You should go picking country by country. You will see a huge penetration in countries as, for example, Spain, UK, even France. Other countries such as Italy, Portugal would be in a middle term in that sense. Germany, surprisingly, is a little bit behind in these EMR penetration systems. Of course, Nordic countries are doing really well. And then if you start moving eastwards, you see even less market penetration until you get to Russia, when it actually goes up again. So this heterogeneity in the market penetration of EHR systems actually makes it very difficult to talk about analytics on those systems, because of course we rely on digitalization of the data as a first step. So that's kind of the most differential point towards the US. Same happens in Latin America a little bit. You should pick countries same as in Europe. Of course, we will be talking about countries that are developing and still kind of steps behind. But we have two main champions in the continent, which will, of course, be Chile on the one hand, and Colombia on the other hand, who are developing very fast on digitalization. They have great governmental initiatives in that sense. And thus, of course, developing on the cluster of companies actually analyzing on top of those data.
So talk to me. I'm interested in what you said about the data is coming from different EMR systems, and there's a fragmentation there. And here in the U.S., we talk a lot about the fragmentation of data due to interoperability. I guess for you, what is the biggest challenge facing a startup like yourself that really relies on data and analytics in the markets that you're in? What is the biggest challenge? Is it that the systems are all different? Is it that it's dirty data being put in? Or what is the biggest challenge you guys face there in Europe?
Well, biggest challenge is straight away data access.
Okay.
Accessing data is always the most difficult part in our work.
Why?
First of all, it comes from the different systems we have. It's not always easy to access those systems. That's the first thing. But also, besides that's a more technical part, we have also a more bureaucratic aspect, if you want. Organizations are not always fast in making these decisions. Let's say a hospital, for example, or a whole healthcare system in a region in Spain or in a region in France is not necessarily fast in making the decision of, okay, I want analytics on this in this specific use case. This low speed in the sense of accessing the data is always the biggest hurdle when it comes to projects. Once this is passed, the technical aspect of it is something we have very much in hand, and we can actually work it pretty fast in that sense. But most problem comes from the data access as it is.
And as you're moving into other markets, like you're scaling into Latin America and you're looking to go there, is the problem the same in Latin America or is it different?
We're finding the same problem. Pretty much, with one important difference, which is that it comes again to the country, but a lot of these different systems actually, in the case of Latin America, are surprisingly faster in making decisions as the ones in Europe. Let it be because they are even private groups. They have probably a bigger share of private healthcare than we have in Spain, for example. Can also be because the government and institutions are simply more flexible. But whatever the factor is, surprisingly, we're finding that it is faster. Decision making is faster in that sense. Yeah.
Good. There's another question I wanted to ask, and one of the hot button issues here right now is about patient privacy. And there's also here, it's spurned into this other movement that's about if you're going to use my data, I want to get paid for it. So it's use my data, cut me in. Give me your feedback on that. What is your response to that? How are you guys responding to the challenges of patients' security for their data, and do you think patients should be paid?
Let's answer first the first question.
That's the easier one.
Exactly. So patient privacy is a top issue for us, of course, and we're addressing that simply by anonymizing data. So our first and most important concern when accessing data is making sure it's fully anonymized, not just half anonymized or just taking names away. That is not enough. We need to make sure that doesn't matter to what extent we aggregate data, we will never find that patient, and that's anonymization. So that's the first thing and the most important one when addressing patient privacy. Once we have done that, does the patient need to get paid? What I believe is we need to start generating value for organizations, practitioners, and at the end of the day, that will generate value for patients.
Right.
Why paying the patients? Again, we are generating value for you. This is not just for us. This is not just for practitioners. This is not just for organizations. At the end of the day, we're making value for society, and society, at the end of the day, is made up of patients. So, in my opinion, humble opinion, I think we should not be paying patients for their data. We should generate value, keeping the patient in mind.
Well said. All right, Javier. I understand you closed a big round. Congratulations on that. And if anybody wants to learn more about IOMED, please check out my other interview with Javier from Health 2.0 Europe. It was a pleasure to speak with you there. Congratulations on the big round. And thank you for weighing in on these topics for us. It's good to hear what a startup thinks about some of these important issues that are, usually being addressed by bigger companies. So it's good to get your point of view. Thank you.
Thank you so much, Jessica.
It's a pleasure to have you. I'm Jessica DaMassa here at Health 2.0. Thanks so much for joining us.